really graduated from Jaffna Medical Faculty, then did my master's in community medicine and a doctorate in community medicine. I did my postdoctoral training at the Barcelona School of Medicine. And my interest area is non-communicable diseases, particularly cancer control, and then the developing health system and care service. So I have been working closely with the provincial health department and other Northern Provincial Council and all things that to develop kind of health services, and also work with the Department of Education and also some kind of a education analysis and thing about all-level performance and thing. And my current research interest, I have country lead for global research on atrial fibrillation and cardiovascular disease thing with the University of Birmingham. And then our collaborators are from China and Brazil. So we are developing 10,000 population cohort in Northern Province. I am also doing some collaborative work with University of Bristol and Sync Health and Duke NUS, Singapore, and Institute of International Institute of Health Management Research, IHMR, Delhi. These are my academic related and university activity. I'm currently head of the Department of Community and Family Medicine, currently the Dean Faculty of Medicine in Jaffna. I'm also involved in these community activities and working with a few non-governmental organizations. One thing is I am the president of local in Sri Lanka, and also president of Institute of Medical Science Trust and Head Trust, and also president of Jaffna Social Action Center, and also working with this as a honorary medical superintendent with this cooperative hospital Mulai. So these are some of these activities I am involving. Today I want to discuss with you all, and as a kind of a community medicine person, and we have been involving a lot of community engagement through the Department of Community and Family Medicine, and also university as a whole. It has a role. That's what that my talk today. Really, I want this particularly this audience and group of well-wishers and the friends all over the world, and then meeting every Sunday, and then attending this talk, series of talk related to activities that are happening in particularly northern eastern Sri Lanka and other part of the Sri Lanka as well. So this is a good forum for the people, as initially mentioned here, that the university, how the university can engage that always people. The universities are really funded, particularly in Sri Lanka, it's all state-funded universities. So then taxpayers' money and to develop that, and what universities have been doing, and then whether really a university is a kind of a ivory tower, or that to come out of that and do so many community engagements. So then that's a thing that I want to presentation, but I will try to cover with this most of the things what at the Faculty of Medicine what we are doing, and also some of the aspects of community, this one university community engagements also I try to cover. So my thing is the evolving role of universities I'm trying to capture, and then ways to build the engagement, and the community engagement is key. Particularly when we look at these quality assurance of institutional reviews and program reviews of the universities, they look at is one of the important component is ways to build them in community engagement. So I had the opportunity even for this university institutional review last time happened in 2018 to look at that how the university is engaged. So compared to 2018, I am very happy to share, and the university now have opened a lot of opportunities to develop. Um, so then I'm talking about some of the opportunities and way forward, how we can build up that, and some of these already maybe you may work with the university, and I'm inviting other people also to collaborate and work with the university and your institution or organization, then how we can make the changes for the local development and the economy. So the universities in the global now always played significant role in the development of society. That's why that the universities are looked at and also been developed in various countries and various situations. But when we look at this, the way universities started, that's in different countries that um, European thing, and starting from Plato's, this then Germany, French, and then English, and all kind of thing. So the way that universities developed and evolved is totally different. But that our part of the world and universities usually the community really wanted to have a university for the community development. And then now we are living in the fourth industrial revolution, so that the potential role of the universities are changing drastically, and then to provide more technological business and entrepreneurship, and all these kind of skills are really needed for our graduates and postgraduates. So then universities role is changing, and then particularly that the University of Jaffna also need to consider that, and then that always maybe the uh, way forward for the our community also. Uh, and also universities are expected to come up with proactive solutions to the societies, and what we can do, where do we need to move, and what are the possible ways that we can handle the issues. So all sort of guidances and then informations and the knowledge should come from university. So some of the things, because now we are living in the sustainable development goal era. So in that context, so these are the three pillars, the teaching, research, engagement, then engagement with the society. So really what is expected, the academics and or maybe the teachers, the universities, they have to do research in the problems related to the community. So then students, whether it's undergraduate, postgraduate, or any whatever the thing, they should be able to work with their teachers and professors, and to related to the research work. Then only then there's teaching actually with a handful of skill and research. So then researching and learning, then make the people to engage. So when people are engaging and they can really understand the real causes and the factors that are causing the problem, and all these things, when they are out of university and then become like policymakers, administrators, or business entrepreneur, whatever the role, and they can understand the real society and the value of the society, so that will help them to work. So that's the way that universities they can't limit their students only inside the lecture halls or that laboratories or anything. So they have to be outside the university and should be in the community. So that's what that now that universities are expected to do. And also now, because of these uh, electronic and these artificial intelligence and technological changes, so then now we are talking about big data and intelligent, this AI and all these things. So research funding researchers and then coming up with these new products and product marketing and all kind of thing. So we have to work with the population. Then population data is very important to produce new knowledge, and then that only help us to come up with the solutions that are useful to the society. So what is expected is the universities should be sources of new knowledge and innovative thinking. And then of course that most of the time from the inception, since the inception, that universities are producing skilled personnel, uh, but that with credible credentials is an important thing. And also this university should be able to attract the international talent and business investment into a region. So that is one of the things university should be able to play. And also its place as agents of social justice and mobility. So particularly we have to ensure that how the resources are distributed and how the things are maintained, that equity is maintained in the population. And also university, it has a role, that social and cultural vitality, particularly these our community, these university Jaffna, these Tamil cultural things, and we have academic, now that we are thinking about Ramanathan Academy of Fine Arts and things, then planning to become as a faculty and all those kind of things. So then it has a role that university to play. So we need to ask question, and you all will realize and understand. So around the world, governments heavily invested in universities. Why are they investing? So that simple answer, then uh, the universities are expected to contribute to the development of the local economy. So we need to ask whether are we doing that enough, and if you're not doing it, and we need to find out the way how we can as a university to do that. So is that the only role that university expected to contribute? So, and then as I already mentioned, this innovation and exponential growth and the technological thing, it should work out whether that come up with these new innovative ideas which should be able to get this, the equitable distribution of resources, and then the social and cultural vitality, as I already mentioned. So what need to be articulated by these universities? So what they stand for and their true role in society. So when you look at these, some of the leading universities and mission statements of thing, and Harvard and say to educate the citizens and citizen leaders to society, we do this through our commitment to transformative power of liberal arts and sciences education. And Oxford say our colleges, faculty, department, and divisions to provide world-class research education, do this in a ways which benefit society and local, regional, national, and global scale. So all these universities, when you look at, then all are saying that then engagement is one of the aspects. So But we don't know then we are universities really doing enough. So that may need to, it's a researchable question that need to be thought. So what is important, as I mentioned, the core values created by the institution. So there are certain issues and criticism about these core values developed by this University of Jaffna particularly. Uh, because the University Jaffna is a kind of a unique feature because it's converted in 1974. Some of these local schools converted as a university and then later became as a university in 78, and most of the time the developments in the community really contributed a lot, and the time, effort, treasures, and a lot of things needing this to establish this university. So then present vision of this university statement to leading center of excellence in teaching, learning, research and innovation, scholarship and community engagement. So Jaffna University also identified it as a kind of a thing then, innovation, scholarships and thing. So mission statement that to achieve the vision, we have trained intellectually and professionally competent graduates, current and emerging needs, national, international community, engage in research innovation, research commercialization, promote scholarship and engage with industry and community. Emphasize on the social, economic and cultural needs of the modern Sri Lanka. So mission, and also we have identified this core value of the University of Jaffna. It's excellence, integrity, accountability, co-creation, community engagement, respect for conservation of nature, unity in diversity, discernment and intellectual virtues. So now that the university, after this more than existence of more than 40 years of thing, so now we have 10 faculties and several premises with 7 unique centers. So I don't want to go to this website and link I provided. So when you look at this university, how it is engaging, the mainly university so far engaging some undergraduate courses, and now only then university started to produce more and more postgraduate courses, so that to build up this capacity building. And then university really can offer a lot of short courses. So short courses again in kind of a formal and informal sectors for the people to get skill and then get international level qualifications for them to go and get a job, and also on the local level of the entrepreneurship and all kind of thing. And also it's good to provide some in-service training programs, particularly these in leadership, team management, planning and all kind of things. So, and also capacity building program, some of these language, and then computer and all kind of things as a kind of. So then we have a kind of the graduate studies, and that of course we can faculty of graduate studies through that, or maybe we have a center for open and distance learning. So its center is with all fully equipped and facilitated place. So then through that also the small courses, certificate courses, or diploma or higher national diploma courses can be created to build the capacity. That's a way then the community that can engage. And also some of these care services also we can provide, like care for elders, and then how to care these mental health people, and or maybe care of this palliative care and some sort of kind of thing also now we are planning through the university. The research activities, actually research activities that are needed to the community and the policymakers. In Jaffna, we have a water issue. Now we are carrying out this with kind of international advisor support and doing a research team, multiple academics and some of these graduates from the University of Jaffna. This, I don't know, website is right. This what the research is really what we are collecting already published thing, because Jaffna, there are a lot of water projects and thing brought up by these various people, and then people were opposing. So we want to develop a local people opinion to develop that. So then it has a kind of a repository and web portal, and we are following this participatory research approach to get the people, those who are working in the field, these farmers and business people, and then government administrators and teachers, school children, and all. We are creating, and then we get them in the forum. So we are creating a web portal on this water related thing. So, and also we started to monitor some of the wells where that we get this water scarcity, and then some of the students from agriculture, engineering, and social science background, they are working to do their postgraduate studies, and some of the wells in I don't know, I couldn't get that. The wells, even in Karanagar, now we started to monitor the wells in the Karanagar and all kind of things, and why the certain years we are not getting over extraction and all kind of thing. So that's, and also we are developing young professional water forum, working with these engineers in the water board, and then irrigation, water supply and drainage and agriculture. All these people are getting together and discussing the water related issues. And the second project I want to show that one of the things with this Norwegian collaboration, this is done by this Professor Ravirajan, and then the thing is about this clean energy problem and thing. So that is one project. So other project, as I mentioned, then with the University of Birmingham and Global AF. So now we are working, and 4 research fellows and around 38 data collectors, and then 10 data collecting assistants are working to in this project to collect these 10,000 people. We educate them and about their diabetes, heart disease, and all sort of non-communicable diseases, how they can prevent. And also we are getting their blood samples and then check for their sugar and blood pressure, blood mass index, and why these people are developing diabetic, heart disease, and also their care pathways, how they are getting the treatment, and what are the issues when they want to get into this care, and why are they not getting this continuous care, and all sort of things part of this study is going on. And there are community supportive projects, and there are so many projects going on at the moment. Some of the projects with science, faculty of science, zoology, natural science, zoology department, and then the some of these social science departments and engineering faculty and agriculture faculty. So I'm sharing this one of the things what we are doing with WHO Sri Lanka. Then they wanted to have a kind of a WHO, so this healthy city concept. The healthy city is a concept is started in Europe, very successful to prevent non-communicable diseases, particularly change their dietary habit, exercise, and then garbage management and maintain the environment clean. So now this our department with municipal Jaffna municipality and regional director of health service Jaffna, government region of Jaffna, and then the provincial directorate of this local government and all, we together with the WHO country office Sri Lanka and WHO Southeast Asian office working to make this Jaffna as a healthy city. And then this will, if we can work out successfully, then Jaffna will be certified as a healthy city in 2 years' time. So there are indicators to be achieved and need to be followed. So there are a team of people and also a group of volunteers from various non-governmental organizations like Omnis, Cerebral, and various, and then SON, and also the Department of Education, Jaffna Zone, and then UNICEF. So various volunteers in Jaffna Diabetic Association like that. Various volunteers, more than 40 volunteers working in this project. We are implementing in 3 settings, one in schools, other one office, and third one in the public places and communities to educate about their dietary habit, exercise, and garbage management are the 3 key areas. Now the Ministry of Health Sri Lanka, particularly Directorate of Youth and Elderly Care, also wanted to join with this Healthy City project. Particularly, they want to work with these elderly access, the elders' access to the services and care. You know, we don't have a proper things, and population is growing. More particularly, that people reach late 70s or early 80s are really struggling to get even health services and things. So how services could be developed in the city also one of the aspects that we are focusing through this Healthy City project. So, and also we work with this closely with the Provincial Director of Health Service and thing to develop these community-oriented primary care. So some of these with this center, we develop kind of a things. We provide care services, special care things for the children and also elders. Our team people visit this home care and thing. So with this experience, now we are working with other primary care institutions to support this project, and we are working to strengthening primary care is one of the another aspect that's in the more at the moment government of Sri Lanka is working because you know then because of these diabetes and hypertension. So there are a lot of endowments provided by these things. So one of the endowment really started in early 80s through the Lee Foundation. So Lee Foundation and Sing Health. Now we got this orthopedic development program. So that through that, and we try to provide some research and training programs and also activities. So Lee Foundation is very keen and to strengthen more. So we are getting in one more orthopedic surgeon in near future, and then we are trying to expand more services to improve the orthopedic care, particularly for the disability and preventing and then providing rehabilitation services. And there's another endowment is from this memory of Mr. Tampaya, that son family, they provided amount of money that is with the university. So now with that endowment thing, so we started to work, look at these, particularly the esophageal cancer, and how this esophageal cancer that is progressing, and why our people are getting esophageal cancer, and then some of this early screening endoscopy study. Now we started at teaching hospital with the support of Sing Health. So we want to screen the people coming with peptic ulcer symptom or dysphagia and thing, and using some, we call iodine, that as a kind of an early screening thing, and whether we can detect. So now it's in the early stage. Now we have screened already 40 people screen, but we need to screen around 550 people, and only we can find out whether is it we can detect early and then prevent this esophageal cancer. Then follow up of this, then we want to go to the community. So this one help us who are the risk people. So when we have the risk people, then we can go to the community and improve that thing. So these are the endowments really helping us. So then what I'm proposing, and then in future, then people, if they can donate and things, with our resources available, now our medicine department of medicine, we have 8 physicians working, and 2 professors. And in department of surgery, we have 9 surgeons, and then 2 more people are joining, and then 2 anesthetists and 1 radiologist. So we could able to expand more services to the people, like that obs and gynae. At the moment we have 4 obs and gynae consultants, like that various departments we have enough expertise. So then we could able to provide, in addition to providing the undergraduate education, these things are also possible. And then scholarships and bursaries. So when you look at, then there are plenty of scholarships, and to encourage the students to do the undergraduate thing very well. And also there are bursaries available for the students coming from needy families to continue their education. And also most of the time now we encourage the students also to pay back, and then do this thing to the future students to work. So then people can contribute to this development of their children in the region. And then we facilitate that the international collaboration. Already I showed this, some of these universities and institutions, and also with the World Bank and thing. And also we are very happy to have a kind of organizations, then charitable organizations and all to work with us. So then also you can bring the collaboration of international organization or world-class institutes, which will actually give good exposure. Now I mentioned with us around 70 to 80 youths working in various projects. So they get this exposure, even they work with these collaborators from China, Brazil, and Sri Lanka and India. So then we are getting this, if this over, then we will get people coming from India, And like that, then when they expose and working with different people, that will help our local students to think out of the box and see the world. So, and that is what that this collaboration can bring that value to the local community. So that's the role of university. University should be able to, and also when these communities are coming to this region, that region also will get more benefit now that we are able to provide them employment opportunity because of these research collaborations. At the same time, these people are learning skill, and also then when these collaborators come here and then they also come and stay in the facilities, and then they eat local food, and they also understand our culture and all the values. So all will benefit. So then we want to provide a kind of a eco healthy friendly tourism and to flourish our area. And then very important aspects, and I want to make it as a kind of dean of the faculty, because particularly I'm trying to get more students coming from abroad. Then we have a system, then they can apply wherever they are from, Europe or England or North America or Canada or Australia. They can apply and get the sheets. So then universities are offering the medical course, charging 12,500 US dollar. So this year we got around 55 students. 3 weeks back, that University Grant Commission chairman had a meeting all the deans of the faculties. So unfortunately, Jaffna University didn't get any single student showing the priority to come to Jaffna medical faculty. Problem is, you know that we are far away, and also these accommodation, all sort of things. And most of these faraway universities are not, Rugunu University also didn't get. So the faraway universities are not getting enough foreign students. So when they are getting the Colombo universities, and then bring this international students particularly. So then Colombo University every year they get around 10 students, and also they have kind of agreement with the Bhutan and Maldives. So then they get at least 20-25 students. So from each student, when they get 12,500 US dollar, that is a huge money. And then at least they have 100 students. So when they have 100 students around, that is about $1 million. No, then the $1 million will useful to develop our faculty, hospital, and all these services for our development of this region. So then we are very happy then if you can all promote that. Our kids to people, they go to the East Europe or Caribbean island, they can come here and in their hometown and get the education, they can go back. So that is one of the thing. And we encourage these elective appointments. Most of the students, when they want to get this exposure, so we charge $55 per week. But then other universities like Colombo and things, they charge around $80 to $100. But then we keep that because we want to get more students to come to Jaffna. Then they can get this experience working in medical, surgical, gynecology or pediatric or cardiology, orthopedic, and wherever they want, and working at that, and then get their clinical skill. And while they are working, and then these departments get that money, then they can use that for the development of these particular departments, and they can purchase their equipments and all. So then another aspect that we want to promote these electives, and most of these students, rather than go to some of the Asian countries or African countries, and we can motivate that people to come. So when these people are coming also, then they can stay in the local houses and dwellings develop, and then they can, then that people also will get kind of financial benefit, and also they will eat local food and then travel. All the taxis and three-wheel drivers and all also will earn van drivers. So it's a way that we can bring more benefit to the community. And then our students also then work with these students coming from all over the world. So their experience, and they communicate, and they talk each other, understand each other, and that will give them kind of a global experience. And also we want to develop more and postgraduate courses and thing, and we could be able to attract the regional people, like coming from Indonesia, Taiwan, Bangladesh, like that also. So that's a way then we can develop these. So then automatically that our care services also will improve. Then we will get more instruments, and more of our people will become experts. Then because they get training opportunities and all. So then our patients also will get better patient care. So then university also develop kind of a university business linkages. Some of you are aware, but that things. So now that the purpose of university business linkage is government is promoting all the universities to do, and World Bank is funding and to encourage the universities to develop linkages with small and medium enterprises, support them, particularly they encourage them to come and work in our research laboratories, and then help them to develop their product and make it to international standard, and facilitate them to get kind of a ISOs and that kind of a thing, and also help them to maintain the quality assurance and thing. So recently then there are a few good initiatives. One of the things that you would have heard is one of the UK entrepreneur came, and he wanted to develop yogurt, this healthy yogurt using the wilwam fruit. So this is one of the local fruit that identified with this Ayurveda thing. So the useful for the diabetes and thing. So then now at the Faculty of Agriculture, and then things, and using this through the university business linkage. So at the moment, and also I work with some of the engineering students. They come up with this kind of a solution for the people at home, because these elders, they can't come to the clinic, and while they are at home, then whether we can measure their blood pressure, pulse, and things, and using some wearable these bracelets, and monitor the thing and using. And I actually circulated, and some of the people are aware. That concept is presented in the International Electronic Engineering that Standard Association thing, and under this undergraduate category that we got this first place, and now we are working to develop that, to bring them into the market. So then we had to work with this kind of industry people to develop. So these are the things that we want to do it through the university business linkages. So in this linkage I have provided in my thing, and you can go and see. I don't know that some of the links are not working, maybe my bolt. So I'm actually almost finishing my thing. How can we work together, work in short-term projects? So simply then when you write to the head of the department or dean or somebody, and then relevant department, then we can make it, and we can put it to the university senate, and then the finance department and finance committee meet once in a month. So then we place the budget and things, and then the budget could be channeled through the university finance department, and then project could be implemented. or work in long-term projects. Now we write MOUs, memorandum of understanding. Even we have a memorandum of understanding with that chartered accountants things and SEMA. Then with these Sync Health, University of Birmingham, and various organizations, and also then even recently that we have some of the zoology. Professor Kajapati started to work with this Tinne group, some kind of studies about the nature conservation and then some of the environmental thing. So and also we can go for the specific agreements also when you want to implement certain projects. So this we already mentioned now that building international student and community interactions really help our local communities, especially youths, can learn from others' experience. So that is one of the things that university can offer as a community engagement. So this is my last slide, and I'm very happy to hear from you and your things and answer your questions. I'm looking forward to work and create healthy and prosperous community. So that is the role of the university. So when we work together, then we can simply bring the development to the region. Thank you very much for the opportunity.